Hello and welcome to my talk. My name is Susanne Kirchner and I'm presenting our paper, They Don't Always Think About That, Translational Needs in the Design of Personal Health Informatics Applications. What motivated our research? Work in translational science has drawn attention to existing research practice gaps in HCI, which prevent practitioners from learning, accessing, and implementing recommendations from academic research. It is particularly important to address this research practice gap in the area of personal health informatics because of its complexity and high impact. For example, the personal health informatics research community has called out problematic assumptions in the design of many current health tracking applications, such as sharing data in the family context. Such design assumptions can also exclude or harm people, as in menstrual tracking apps that misgender people who are tracking, or incorrectly assume tracking for purposes of planning or preventing pregnancy. This motivated us to pursue the following research goals. We wanted to explore opportunities for translational resources in the design of personal health informatics technologies, such as making design considerations more explicit and supporting designers in rethinking potential assumptions about designing for personal health informatics. We further wanted to learn about the needs and practices of health designers in translating research into practice so we can formulate implications for the personal health informatics research community to better support health-focused designers. For this purpose, we created a set of design cards through an iterative design process. Initially wanting to create design patterns, we chose the format of cards, which would allow designers to use them across different contexts and in different stages of the design process. Through 3 purposive sampling strategies, we identified 75 research papers. Our affinity diagramming converged on 5 major themes of design considerations, each with 3 supporting sub-themes, which can be found on the slide. We organized this content resulting in a set of 22 cards. 1 title card as an introduction, 1 overview card with a reference to how the cards are organized, and 5 sets each composed of 1 theme card and 3 detail cards. Theme cards, as shown on the slide, each introduce a primary design consideration, for example, who is tracking, and 3 sub-considerations, each corresponding to a detail card, For example, for the who is tracking, there would be 3 detail cards. First, who is being tracked, second, who is collecting the data, and third, who might be excluded. Detail cards expand on the sub-consideration and include, for example, a design recommendation and questions designers could ask in a design process. We iterated on the first version of the card set after our first set of interviews. We engaged in discussions about the cards and health designers' experience with 12 students, designers of personal health informatics apps, and 12 health-focused professional designers and researchers. We analyzed our qualitative data through affinity mapping, writing memos to further conceptualize identified themes and respective quotes. We identified 3 key findings communicating needs of health designers. For each need, we formulated implications for the personal health informatics research community. In our interviews, health designers shared that it is important for each health designer to learn about health-specific design considerations and implementing inclusive design principles. One implication we formulated for that is that in order to not overwhelm less experienced designers, the personal health informatics research community needs to consider different levels of expertise when designing translational resources. This is one example of an implication we formulated. Additional implications can be found in the paper. Health designers further shared that they need to advocate for appropriate design principles in front of multidisciplinary stakeholders who might not be aware of them. In order to address that, translational resources created by the personal health informatics research community can provide support by targeting the education of multidisciplinary stakeholders with different perspectives. Lastly, health designers highlighted that the difference in background and context of a health designer, for example, in industry or academia, can shape different expectations and convictions on what is considered evidence. The personal health informatics research community can address this need by emphasizing the evidence base of design recommendations and making them easily accessible. Thank you very much for listening, and I look forward to your questions.